Warren's Medicare for All plan reignites healthcare clash. Washington, AP. Elizabeth Warren's proposal to gradually move the country to a government-funded healthcare system has further inflamed the debate over Medicare for All, likely ensuring the issue will play a significant role in this week's Democratic presidential debate. The Massachusetts senator announced Friday that her administration would immediately build on existing laws, including the Affordable Care Act, to expand access to health care while taking up to 3 years to fully implement Medicare for All. That attempt to thread the political needle has roiled her more moderate rivals, who say she's waffling, while worrying some on the left, who see Warren's commitment to a single-payer system wavering. The divide could complicate plans by Democrats to turn healthcare into a winning issue in 2020. The party successfully took back control of the House last year by championing programs that ensure that people with pre-existing medical conditions keep their insurance coverage, while arguing that Republicans want to weaken such provisions. But the Medicare for All debate is more delicate, as advocates including Warren grapple with concerns that a new government-run system won't provide the same quality of coverage as private insurance, and would be prohibitively expensive. The Medicare for All proposal has turned out to be a real deal-breaker in who gets the Democratic nomination, said Robert Blendon, a Harvard University School of Public Health professor whose teaching responsibilities include courses on political strategy and health policy and public opinion polling. This is not just another issue. Warren's transition plan indicates she'd use her first 100 days as president to expand existing public health insurance options. That is closer to what has been supported by former Vice President Joe Biden and Mayor Pete Buttigieg of South Bend, Indiana. Both Democratic presidential candidates have criticized Medicare for All for wiping out private insurance, something they say many Americans aren't ready for. Warren insists she's simply working to expand health insurance in the short term to people who don't have it, while remaining committed to the full plan in the long run. "My commitment to Medicare for All is all the way," Warren said while campaigning in Iowa over the weekend. Still, the transition signified a step toward pragmatism and an acknowledgement that the government has ways to expand health insurance coverage before embracing a universal system, something that would be difficult for any president to get through Congress. Consider that current entitlements, such as Social Security and Medicare, were phased in over years, not all at once. If she's looked at it and decides the sensible thing to do in order to not cause too much disruption in employment. See for more on this story, visit the news article link.